Okay, welcome everybody. We are on the inside here for the headache and migraine free report, and let's get going. But before we get into it too much, very important that you stay till the very end. There's something that I'm going to share with you that I've shared with my patients here that has completely changed their lives. I'm going to share that at the very end. Make sure that you stay for that part. It'll only be about 14-15 minutes. So let's dive in. So first, very important is, when we talk about headaches and migraines, is looking at the cause of the problem. So when we look at the cause, we look at the central arteries in the brain. And what happens is sometimes those arteries dilate. And when they dilate, there's a meshing of pain fibers around those arteries that when the artery expands, they signal those pain fibers, and boom, you get pain. So every time there's a pumping of the heart and a wave of blood goes through that vessel, the vessel expands, and those pain fibers act like a tripwire, and boom, 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 you get that crushing, splitting, stabbing, headache and migraine type of pain. And when that happens, your body has these chemicals that gets released from this inflammation, and these things look like, these are different chemicals like calcitonin gene-related peptide, bradykinins, substance P, centralized pain windup, cytokine response, prostaglandins, histamines, and these are just a few of the components that drive chemically mediated pain. So when we look at these things, they can all be wrapped up in a word, and that is inflammation. And when we look at inflammation, whether it's chronic or acute, we can also just say this is stress. Now, stress is one of these terms that gets thrown out and becomes very nebulous. But stress is very real, and it's not something just that you're internalizing. Stress, in many cases, can be weighed and measured. And this is where a lot of the solution to your chronic and acute headaches and migraines lies. So let's look into stress more clearly. So there's only 3 types of stressors. So one, we look at chemical stress, mental emotional stress, and physical stress. So let's pick these apart a little bit. So when we see this, then we know in this formula here of just these 3 stressors, this is the source of your migraines and headaches. And this is a source of stress and inflammation. But the solution for this is in the Balanced FFL method that we will go through. So as we look at the chemically related stress, we have things like blood sugar, nutrition, digestion, endocrine function, toxicity, oxygenation, cellular stability, immune function, dehydration. These are things that are all in the chemical stress category. On the mental emotion side of the equation, we have things like deadlines, bills, kids, carpools, spouse, friends, gossip, politics, news. These are all things that weigh on you and can actually change your chemical makeup, like cortisol. Finally, we look at something like your physical stressors, and this could be from bad posture, lots of computer work, lack of fitness, spinal dysfunction, dehydration, injuries, car accidents, and poor flexibility, just to name a few. So when we look at all these things together, there's a whole lot going on here. And it's usually not that people have one of these things happening, but multiple of these things happening, and the chemical part feeds on to the mental emotional part. The physical part feeds on the chemical part. They all wind up together. So we have to look at these things and figure out, well, these aren't just pieces of different problems going on. But that's a lot of times how people get treated. They get treated like they are pieces of a whole person. So that if there is some neurological misfiring, we look at just a neurological specialist by looking at something like the cerebellum. If there's poor blood sugar going on, we look at a nutritionist for something like that. If we see the cortisol off, well, maybe you go see an endocrinologist for this. We have the structural side of the equation off, and you go see a chiropractor or a massage therapist or a physical therapist. And so we're pulled in all these directions, and none of this is working synergistically to make you whole. You're having little pieces of this worked on. And the thing is, all these pieces have some common threads with pretty much all chronic health disorders. So, and in these health disorders, headaches and migraines certainly is in there, and it's way up on the list because we see a ton of this, and we don't have to suffer like that. These common threads are oxygen deficiencies, neurological misfiring, metabolic imbalances, and mechanical overloading. These are the common threads running through all these conditions behind your headaches and migraines, behind your stress and inflammation. So why don't we go ahead and look at the things that are your biggest detractors, taking away from your oxygenation, metabolism, neurologic tone, hormone regulation, and ease of your joints and muscles. So we have to look there for these solutions. And that's exactly what we do in the Balanced FFL method. And the FFL stands for Form, Function, Lifestyle. Now I know that sounds so simple, but oftentimes the answers truly are simple, and oftentimes we complicate them. When we look at these areas, the form, function, and lifestyle, and we look at the barriers that are taking away from balance in these areas and how to restore that, then what patients experience is a synergistic improvement in their overall whole performance. So a lot of times, years of suffering with this holistic, natural, and simplistic approach works to quickly throw you over the threshold back to the area where life is pleasurable, where you enjoy being with people, where you're okay to go watch a music event because it's not going to be too much for you, or go out in the sunshine because it's not going to be too hard on your eyeballs. This is the approach that we're talking about, and it works wonderfully well. It's been clinically tested for years, and we have many, many patients over the years who have gotten their life back through this simple method. And by doing this, we look at you as the whole person that you are instead of doing it bit by bit. And we do it, even though it's simple, we do it on a multi-level factor. So we may need to do blood work, we may need to do diagnostics, we may need to do different kind of evaluations depending on what you bring. It's not a one-size-fits-all. So that way we can pull all the pieces back together and get the cortisol back in check, get the blood sugar back in check, the structural balance working well, oxygenation doing well, the neurological firing to be balanced out. This is the key to truly getting your life back. It's the Balanced FFL method. So one thing for sure is that this is not the traditional approach. Because it's not solely centered on your symptoms. Your symptoms are important. They're important to you and they're important to us, but they aren't always the neon flashing sign of where the problem is. So instead we focus on the cause of the problem. And by doing that we can quickly get to results. And these treatment options will not be limited to drugs, injections, more drugs, surgery, and we certainly aren't going to tell you just live with it. So obviously, if you ask a hammer what it can do for you, all it can do is hammer. So on the traditional approach, there are drugs and there's surgery. That's it. Drugs and surgery. So would you rather use a toolbox that is one, synthetic, two, limited by two tools, or would you look at something different? A neurometabolic approach, where we have things that are such as the chiropractic neurological adjustments, brain balance therapy, whole body vibration, primal 7 movements, interactive metronome, cold laser, functional blood chemistry, nutritional therapy, massage therapy, craniosacral therapy, kinesiotaping, variable percussor, LDOAs, and these are just a few of the tools that we use. Now it's not that every person needs all of these things, but our capacity to help is so much greater because we have more capacity, more tools that we can use. Now everyone needs something different. You need exactly what's right for you. It's not a one-size-fits-all. Just like it's not a one side, in the other model it's one of these types of drugs. Here it may be anywhere in here that we look at. And when we do that, our focus is so that we balance out the cerebellum and cerebrum. And one of the most important things is that we have the proper fuel for the brain. And this fuel comes in the form of oxygen and glucose. This is what the brain feeds on. So earlier we talked about how the artery dilates or expands in the brain. The reason why that happens is that people who experience headaches and migraines, their blood is weak, is deficient. And so to get deficient blood to feed the brain with this size of an artery isn't going to happen. So it has to expand to allow higher volumes of that in to feed the brain properly. So if we can enrich the blood through the Balanced FFL method, then your arteries don't have to dilate. So then we have to look at, well, what are the reasons why your arteries are dilating? But the big thing is we have to make sure fuel delivery is happening, and that's through oxygenation and glucose delivery. And then very important is that we have to exercise the brain. And we do this through coupled chiropractic neurological adjustments, brain-based therapy, nutrition therapy, and more, like we talked about before. And when we do this, we get balanced tone between the two hemispheres of the brain, and you work synergistically with your body. So naturally, I'm not going to tell you that we're going to help you through a magic pill, because we know that there is no magic pill. That's why you're here. That's why you're listening to this. Instead, we find the source of the problem through a personalized evaluation. We remove the causes of the dysregulation through specific changes. We repair damaged tissues through nutritional therapy. We balance the immune system if that's required with specific nutrients and vitamins. And we improve and balance brain function so that your brain is in concert with your body. And that is a far cry from a magic pill, right? So you have to ask yourself, how much do you want to get better? How have your headache and migraines affected your life? How much has it cost you in time, money, and sleep? Where do you picture yourself in the next 3 years if you don't change? And what can you do to improve your condition? I just want to tell you this. Our regular evaluation is $510. And what I'm offering you today is I will move that decimal point over one spot and turn that $510 into $51. But you have to ask for the $51 free report. So call in 306-9800 and Maggie will get you set up. And just tell her I'm calling about the $51 special offer. This can very easily and probably change your life for the better, for good. We look forward to seeing you soon. I wish you all the best.